My name is Heather Lutzy, and I work here at Health Products for You and Shop Ostomy Supplies. .com. And I'm joined tonight by Christine Kijek, who is our ostomy and wound nurse. She's also joined HPFY.com and shop ostomysupplies.com. And she's a specialist. She's been in this industry for over 20 years, and we're so happy to have her tonight. Again, thank you everyone for joining. And tonight we're going to be talking about a topic that I'm sure is on a lot of our participants' minds tonight, and that's intimacy and being an ostomate and how to deal with the process of intimacy as you become as an ostomate. So with that, I'm going to turn the microphone over to Christine. And Christine, it's great to see you. Thank you again for your time, and take it away.
Thank you, Heather. I appreciate that. So this is a touchy subject for a lot of people, and a lot of people don't want to talk about these issues, but ostomates face a little bit different challenges. But with that said, sex and intimacy are really important to our well-being, both physical and emotional. And we all seek to feel loved and feel desirable. It doesn't change after having ostomy surgery. So any relationship challenges that face ostomates also face people without ostomies. These include feelings of insecurity, how we feel about our bodies. Nurses call this body image. And ostomates have those added thoughts and concerns of how will the ostomy affect my sex life? How will wearing a pouch impact my sexual activity? Also, will my partner reject me? It's a lot easier to hide a stoma when you're wearing clothes and you're leading a normal life every day. But thinking about removing your clothing during an intimate encounter could be really daunting. And this will challenge your self-confidence. So those with stomas can lead normal, happy, and fulfilling lives and relationships after surgery. It just may take a little bit more talking about it to get there. So whether you have an ostomy or not, everyone at some point in their life will experience some type of sexual difficulty. Most of us, again, with or without a stoma, we all have body insecurities. But I want ostomates to remember that we're the same person on the inside and in our hearts. Your body's just a little bit different. So coping with that, it's very doable, and we can help you get through that. If you're fortunate enough to have had a partner through your illness and through your ostomy surgery, resuming intimacy before you do that, talk to them about your concerns. Most likely, your partner will have concerns as well. If you're single and you're out meeting people, I'm sure you're wondering how to approach that subject. Again, how do you bring that topic up? Most people won't talk about it until they decide their relationship is becoming more serious and they're ready to become more physical with that partner. And it is best to have that discussion with them before you become physical. It's probably easier to talk about your illness and how sick you were and why you ended up having an ostomy surgery, and let that sink in with them. Give them time to absorb that and realize how grateful they are that you are still alive and well.
That's great information, Christine. When it comes to the right time, is there a right time, or when is there a safe time to start if, let's say, somebody's just had surgery?
So there really is not a set time to resuming sexual activity. Keep in mind that recovering from a serious surgery such as this, it will take time. And if you're feeling physically tired or you're still having any type of pain, you're most likely not thinking about having sex. So you do want to take care of your body first. Learn how to manage your ostomy before you start planning intimate encounters. Once you are ready to participate in sexual activity, here's a few tips that might help you. First, you want to empty your pouch before you get started. You want to maybe consider using a pouch deodorant. If you're wearing a clear pouch, something that it doesn't have a cover on it, consider wearing a cover, a pouch cover. They come in all sorts of different colors and fabrics and things of that nature. Consider wearing a wrap around your pouch. And I actually have one here. We've talked about it at other webinars, and men or women can wear these. It's a tube top type of product. And it's got a pocket on the inside that holds your pouch. So that will hold it close to your body, and it's not exposed for your partner to see or worry about or anything like that. Those with colostomies can, instead of wearing a whole pouch, they do make these caps that you can place over your barrier. So it's much smaller. So this will get in the way less, and then you might not need to use one of these covers. Start slow and gentle. Loving and kissing and touching and tenderness are all parts of that pleasure that you can achieve during your intimate encounter. Most people can participate in conventional positions unless there's some physical attributes that cause you pain, and then you might want to consider choosing other positions. I will take this moment, though, to show you some products. We talked about the wrap. Ostomy Secrets makes many products, and they're great for your intimate encounters. I have a woman's boy short here. It's nice and lacy. Again, it's got a pocket on the inside that will hold your pouch close to you. Here's another one. That is tan, lacy, again, with pockets on the inside to hold your pouch. And they make underwear, nice, sexy underwear that you'll feel happy and desirable in. Again, it has a pocket on the inside to hold your pouch. For men, I would stick with the wrap. Or Stealth Felt makes this, it's a little bit smaller. All right, it wraps right around your middle. Your pouch goes right into this pocket here, and it zips up on the bottom. So this is great. You know, if your stoma is in the middle, off to the side, you can just move this around to get it where you need it. One more option, women, we do have a slightly sexier kind of wrap with some red bows. Those people like those quite a bit.
That's great.
Yeah, so they do have lots available. I do want to mention at this point, a no-no, never use your stoma for penetration, all right? That is definitely a no-no.
Now, when a female body starts to change, right? There are some is there changes that women can experience with an ostomy surgery that would affect sex maybe, or? Sure.
And I'll start with some general stuff.
And you know what, Christine, let me just say, I didn't mention in the beginning, and for those of us who are new to this webinar, if at any time you have a question, please use the Q&A section, and I will address the questions at the end of the webinar. If Christine talking, we will answer those questions. I'll read them off and answer them. So excuse me for interrupting.
No problem. So I'll start with some generalizations. Again, your first intimate encounter after surgery, it might not be perfect because you're getting used to things, your partner's getting used to things. Some men, though, can have difficulty getting and keeping an erection. Certainly will depend on the type of surgery you needed. Women can experience pain with penetration. They may have some vaginal dryness, which we can all work with those types of things. Surgery in the pelvis alone causes changes. Some of them are temporary because you're going through a healing process. Others can be more permanent, and we'll talk about those in a moment. But the reason why you had this surgery to get your ostomy, if it's cancer surgery, we'll start with that. Rectal cancer, bladder cancer, those surgeries remove more tissue in the pelvis. So something like an abdominal perineal resection. The more tissue that's removed can cause changes in blood flow, nerve endings or nerves that run along the rectum that innervate sexual activity. can sometimes be damaged. So there's a different impact for people who have these surgeries for cancer versus those who have surgery for Crohn's disease or UC. Now the changes for women specifically, some surgeries will affect sexual function because removing part of the rectum or working down low, it can shift your organs. So it can shift how your uterus sits. It can actually change the anatomy of the vaginal canal based on how low your surgery is. So pain and dryness are the two biggest things. However, damage to those nerves are going to change your sensation, and you may have an inability to climax. If that is indeed happening, I'm certainly referring to a physical therapist who can help with some pelvic floor strengthening, can help with some of these issues. If you have the vaginal dryness, we recommend lubricating as a helpful way. And some of your medications too that you take can cause the vaginal dryness. So we want to look at everything. And certainly your GYN can help you in that aspect. If radiation was part of your treatment plan, that really can cause some vaginal scarring, and that will cause some tightness. There are vaginal dilators out there. They come in kits, start out small, work your way up, and the instructions for use of those will be provided in the box when you buy the kit, or you can talk to your GYN. And in fact, sometimes some of the GYNs will go ahead and provide you with that rather than you needing to purchase it.
So that's really helpful information. Can I ask, I mean, obviously when it comes to intimacy, contraception has to be a factor. Does that affect being an ostomate, affect using contraceptives?
Absolutely. So for those with ileostomies, pills may not be fully absorbed and they can be excreted into the pouch before you get the full benefit. So birth control pills, you have to really be careful with that. If you have a colostomy, it should not be an issue. Types of surgeries, as I mentioned earlier, can change the anatomy of the vaginal canal as well as the uterus. So using something like an IUD or diaphragms or cervical caps, they may be more difficult to use because of those changes. There's other types of hormonal birth control that are more appropriate for patients who have stomas, and that would include injectable hormones, birth control patches, and certainly condoms. Condoms are very effective, and they also prevent sexually transmitted diseases. So I do recommend those especially if you're just starting out with meeting someone. If you're thinking about starting a family and you have a stoma, this should not be an issue. Oftentimes normal vaginal delivery is okay, unless of course you've had one of those cancer surgeries where there's changes that won't allow that, and that there's no damage to the reproductive organs.
Well, I've been focused so much on women. There's obviously much to talk about as it pertains to men as well. So what are the changes that men experience?
So for men, again, with a surgery down low in the pelvis, such as a cancer surgery where they remove more tissue, the nerves that stimulate erection and ejaculation run very close to the rectum. And so those nerve pathways can be damaged from the surgery, inflammation, especially more fresh post-op within the first few months. Impotence is when you have the ability to sustain an erection long enough to climax. And temporary, it could be a temporary issue for maybe a period of about a year. Nerves take a long time to regenerate. So we don't know until after that year whether or not it will be permanent or not. If it remains a problem once healing is fully done, say after a year, there are some surgical interventions, specialized surgical treatments that can be done for those struggling with the impotence. But you can make an appointment with your urologist and they'll evaluate and discuss with you the options that are out there and available to you.
Yeah, I can't imagine. I think that, there's got to be ways to, when you're going to be intimate in general, it's got to be so important to strengthen the relationship any way you can to become as close as possible. And whether you're an ostomate or not. And I know that
Sure.
some people might feel that that is a hindrance, but I think in general, what suggestions can you give just for the, especially if this is a hurdle that they have to climb, which could be a little different from other couples.
Sure. So strengthening your intimate relationship, to do that, you really need to be able to talk with your partner, be upfront and honest. Most people, they don't understand what a stoma or an ostomy is, let alone knowing how it can affect sexual function. So it's important that you have these discussions. Provide your partner with education on what the stoma is, what you're afraid of. They have fears too. Are they going to hurt you? Are they going to damage the stoma? So talking about it is going to be very important. And there's a few topics too that I would recommend that you talk about before you become intimate. The physical limitations. So for men, the limitation of erection. For women, the vaginal dryness and the need for some added products. If you're having pain with intercourse, right? How much do you really desire doing that if it's going to cause you pain? And sometimes that's just a matter of positioning. Maybe you don't want to be in a conventional position because that causes more pain. Fears of rejection, fears that my pouch is going to leak, or there's too much odor, my partner can smell it, removing your clothing, am I going to be able to perform? These are all valid fears for anybody with or without a stoma, other than the leakage. And then sexual activity. What do you like? What do you not like? What you liked before surgery might not be what you like after surgery based on changes after the procedure. Emotions, you really can be battling emotions such as guilt, resentment that you've had to deal with having this, anger, loss of libido, not being interested in having sex. All of these things are very important topics to have discussions with your partner. It's a giant step towards meeting your intimacy needs and your partner's intimacy needs. The changes after surgery, they certainly will affect your life. They can be frustrating and upsetting at times, but keep in mind, you are special. Sexuality is only one part of who you are.
Yeah, that's wonderful. That's great information. If it's okay with you, I'd like to just see, we've got a couple of questions here, if I could ask them.
Sure.
There's one that's, what if the ostomate had UC and the partner doesn't know what it is?
Okay, so ulcerative colitis, again, the ostomate can educate on what that is. Inflammation of the colon, it actually causes ulceration. Some people, it can be managed with medications, and some people need their whole colon removed. And so with that, you're going to end up with an ostomy. There are a few surgeries where they can attach your small intestine right up to either the rectum or the anus. It still may make some changes as far as sexual activity goes, but it's less invasive than I won't say invasive. You still remove less tissue than what's removed during a cancer surgery. So your sensations might not be as affected.
We had another question. What if your partner rejects you because you have an ostomy? I've experienced this in an encounter, and I felt I was the stronger person. However, because the ostomy saved this person. So this person is asking that. I mean, I think that the last portion that you spoke about, Christine, answers this beautifully. So
if somebody is completely turned off by the fact that you have a stoma, I'm not a therapist, I will tell you that, a relationship therapist. However, because it's a major part of who you are at this point in the game after surgery, obviously they're not the right person. And without knowing your background, did they know about the stoma before you became have an intimate encounter? That's how you're going to weed out those people who will be offended by the stoma. Yeah, I definitely having your discussion beforehand before you become physical is very important, so that you don't get to that point where you feel rejected.
Yeah, that's great advice. Even though you aren't, but it is a great advice. It's all about communication.
Yes.
Yeah. Okay, we're gonna leave the floor open for just a few minutes for other questions.
So what I find interesting actually is the differences between colostomies and ileostomies, and how patients are affected as far as their sexuality goes. Colostomies tend to be a little bit easier. You know, you can, if you've had your stoma for a long time, learning how to do irrigation so that you don't have to even wear a stoma cap or something along those lines. That makes things a little bit easier, I think. Unfortunately for ileostomates, they don't have that ability to do that. So it's a little bit more of a challenge than those with colostomies.
We had a comment, a phrase that I've always used is the stoma is what I have. It is not who I am. Try not to define yourself by your stoma. That's excellent. That's an excellent phrase.
Absolutely. And, you know, I did read a phrase as well that says, sex is not what's between your legs. It's what's between your ears. Yeah. Part of it is how you think about it and how you feel. So, yeah, it's not only physical, there's that emotional connection as well.
Ostomate is asking, I'm meeting someone without a stoma for the first time. I want to tell him on the phone before we meet. Others have said to wait and see how the first date goes. What would you recommend, Christine?
I recommend waiting, because rather than, you know, putting that information right out there, you want to know what kind of person they are. I mean, if you've met online, or, you know, you've had interactions with them online, and you've become more personable with them via telephone or online dating or something along those lines, it might be okay to tell them. But if it's like a first date kind of thing, I would hold off. I would hold off and find out, get a feeling for them in what they're really like. Actually, I'd like to take this opportunity to share a story about a young woman that I know that has had a stoma since she was 16, and she's 28 now. And back in the beginning, she wouldn't date. She, you know, just kind of blocked herself off from that. And she's had that stoma 3 times. So she was reversed, had more problems, had the stoma again, had more problems after being reversed. And finally, the 3rd time was a charm. And she decided, you know what, I'm not doing this anymore. I'm just keeping it. Well, she came to me about a year or so ago and said she met someone, and he was absolutely fine with her stoma. And they just got engaged for the 4th of July and getting married. And she can't wait to have a baby. Yeah, it's so good to hear those stories.
Yeah, absolutely.
Yeah, so there are good partners out there. It's just a matter of weeding through them. So whether you have an ostomy or not, you still have to weed through them.
So we'll ask the participants if there's any more questions, and give it another minute. And then if not, then we'll conclude this webinar for this month. All right. Well, Christine, as always, it was an absolute pleasure. Thank you so much for your time and for sharing all of this very valuable information with us. And how do you have your contact information? You obviously can go to healthproductsforyou.com for any ostomy supply needs that you have, or shopostomysupplies.com. And you can always you reach out in the past. Christine, in the past, how have people have additional questions after the webinar? How do they reach out?
I have gotten a number of emails from some participants. And Heather, if you want to put my my HPFY web email address on there, that's fine too.
Okay, sure.
Correspond with patients if they have additional questions as well.
Okay, it's
Christine at HPFY.com. Well, thank you for moderating, Heather. I appreciate it.
Oh, my pleasure. My pleasure. And again, thank you for all the participants for coming in and listening. And we hope that this information will help you to go and maybe do some things that you weren't necessarily comfortable doing. Yeah.
Perfectly said.
Yes. Okay, everyone. Enjoy the rest of your evening. And thanks so much for joining us.
Thank you.
Okay.
Bye now.